Good evening, good morning, good afternoon, wherever you're joining us from today. My name is Dr. Eugenia Caternor, and I'll be your host for today on our next episode of Transformation Talks. And I just want to welcome all of you on the platform today. Today is May 29th, 2025. And as we all know, Transformation Talks is a platform for us to discuss different topics, to educate, to empower, to inspire, to share ideas and our knowledge, our experiences, our insight on different topics. So I'm so glad that you are joining us today. And I pray that by the time we finish, you will gain something from our discussion today. And as we all know, everything we learn here, we want to be doers and not just hearers of thy word. So please, I welcome all of you, and I pray that today's message will help all of us. Even if it doesn't help you, you may know somebody that will benefit from it, or you may put it in your savings account for one day. If you need it, you can use it. One of the things that we hear a lot about, and we hear people talk about everywhere we go, is our weight, which is obesity. And I can tell you it's a big problem around the world this day. It's getting worse and worse every day. And this is a topic that is really dear to my heart because I've been doing obesity management for the past 12 years, and I have gained a lot of experience, a lot of knowledge. So I'm here today to share with you some of the facts about obesity. We're not talking about nutrition today. We're not talking about exercise because we already had a podcast on those. So you can always go back to our previous podcast that we did on nutrition and also our podcast that we did on exercise. But today we're just going to hit the truth about obesity and what it's doing to our lives. And as I mentioned, it may not benefit you, but you may know someone. It could be your spouse, it could be your child, it could be your sibling, it could be your neighbor, your coworker that would benefit from this episode. So if you're here today, please make sure you share with somebody that you know that you think they'll benefit from it. It's the best gift you can give somebody, life. And obesity is killing us. So today we're going to talk about some of the facts about obesity. I know most of you have had an experience with obesity, either yourself, your child, your spouse, a family member, and how it has affected them long term. So a lot of people are asking me to talk about this topic. So I pray that it will benefit all of us. So what do we understand when we talk about obesity? There are a lot of health issues or health problems around the world, and we have medications for almost everything. And a lot of the diseases that we see is inside the body. So nobody sees you. You can even have HIV and nobody will know that you have HIV. You can have diabetes, high blood pressure, high cholesterol, and nobody will know until you tell them. But obesity is very obvious. Whether you like it or not, people see it and people know you have it. So does it affect you? Does it bother you? Do you think about it? Do you lose sleep over it because you are bigger than the average person? If yes, what have you done about it? Or what are you going to do about it? There's a lot of information out there, but sometimes it's not as easy as it sounds when it comes to obesity management. So today we'll talk about some facts of understanding the epidemic of obesity and the truth behind the global weight crisis, and also what we can do so we are not part of that statistics. Okay, so somebody will ask me, what is obesity? Obesity is a medical condition characterized by excessive body fat that increases the risk of health problems. In the World Health Organization, obesity is actually classified as a disease. So health condition versus it used to be, now is a willpower issue. It's a choice that we are obese. When we define obesity, people like to look at it by their body size. People look at it by their race and where they should be. But the truth is, is calculated or is measured by your BMI. If you have a BMI, which is the calculation between your height and your weight, anything over 30 is considered obese. From 25 to 29.9 is considered overweight. Anything under 25 is considered normal. Anything under 19 is considered underweight. Yes, there are some people who are underweight and they wish they can gain some weight. So don't think you're the only one that have a problem. Some people are trying to gain weight. Some people are trying to get a little bit bigger. So don't feel like, okay, your problem is the worst. Okay, so in the world that we live in today, a lot of things come into play when it comes to obesity. Statistics shows that over 1.9 million, actually billion adults with a B, over 1.9 billion adults are overweight and 650 million are obese. So that can tell you that it's a big problem, okay? Childhood obesity has also risen by 10-15% in the past 40 years. Just in the US alone, the rate is at 42% for childhood obesity. And this trend keep going up and up. So what are some of the causes of this obesity that we're talking about today? It could be lifestyle factors, sedentary lifestyle, high calorie diets, fast food consumption. Socioeconomic factors could be our urbanization. It could be a food desert. People live in areas where they don't have the fruits and vegetables that we get here to help us to eat healthy. Lack of education, which is part of the reason why we're doing this podcast, so we can have a better education on what it is to be obese or to be overweight, and how does that affect you as a person. It could also be biological factors like genetics, metabolism, hormonal imbalance. So when you have a diagnosis of obesity, sometimes the doctors don't say anything. All they say is you need to lose weight. I've had patients that will come to me saying the doctor say if I don't lose weight, I'm going to die, which can be very scary, but it's the truth. And if you don't do anything about it, it doesn't fix itself. It's one of those diseases that you need to do something to find the solution for it.
If I would say, the last thing that nobody say, right? So you want to get your guests here, because trust me, tonight will be like,
Please mute yourself so don't interfere with the discussion today, please. So, for instance, sugar. A lot of us consume sugar directly or indirectly, and we don't even think about it. So, if you drink, let's say, a 500 ml can soda, that contains 13 teaspoons of sugar. It's about 210 empty calories that we put in our body. And you can say, oh, I just do that once in a while, but that once in a while keep adding up. And for some people, once in a while could be once a day or every 2 days. Some people could be once a week, but every habit builds up over time. Okay. When it comes to the sedentary lifestyle, an average adult spends over 6 hours a day sitting, especially if you work in an office or you work in the industry where you are on by the computer most of the time. You don't do a lot of activity, which slows down your metabolism and also reduce the amount of calories that you burn. So hence it builds up more extra fat over time. Okay. So when we are sedentary, we have to take that into consideration when we consume food, because it's the calories that goes in and calorie that comes out that makes up whether we're gaining weight, we're losing weight, or we're staying the same. Okay. So if you have to compare an office worker to a farmer, the calorie expenditure is so different. Think about our parents, our grandparents that lived on the farm. They are always active. They're going to the farm, they are doing a lot of yard work. That's how you burn calories. And you wonder why they stay fit, because they are very active. Okay. Some of the health risks of obesity that sometimes we don't see it as a problem, but when the doctors diagnose you with it, then you take medication for it. So one of them could be type 2 diabetes. 80% of people that have diabetes are also overweight or obese. So the problem is, if the doctor doesn't tell you that your type 2 diabetes could be, not always, but could be from your weight, then what do you do about it? They put you on medication and they will check your A1C 3 months later and see if it's going up or it's going down. So now the main cause of the problem is still there, but then we're taking medicine to fix the type 2 diabetes. Now we have heart disease, high blood pressure, or we've had stroke. Again, we'll treat the high blood pressure, we'll manage the stroke symptoms, but the true cause of the problem could be the obesity. It's still there. We're not doing anything about it. Certain kinds of cancers. There are a lot of cancer that are a result of obesity. We don't talk about it. We always blame the person who have the cancer. But again, if we're able to manage the obesity, that could be the solution, or at least delay the onset of those health problems. Childhood obesity is on the rise. 1 in 5 children are overweight or obese. Type 2 diabetes used to be the disease of the adults. Now, a lot of children are having type 2 diabetes. Most of them are also overweight or obese. Okay, so whenever we think about obesity, think about a monster chasing you with all kind of things. And until you run away from it or you fix it, they're going to be behind you and they keep pushing you with a lot of health problems. There's a lot of myth around obesity. You know, people say, it's just lack of willpower. Or it's only the rich people that are obese because they can afford all the unhealthy foods. Obesity is not a disease, it's a choice. Or people can say it runs in the family, so there's nothing I can do about it. But I want to let you know it may run in the family, but there's something you can do to make it better or to reduce the risk of how it affects you long term. You know, we know in the Bible it says our body is a temple of God. So if your body is a temple of God, then we have to keep it holy, we have to keep it clean. So caring for your body honors God. So I always encourage people, think about your body as a house. How do you want your house to be like? Do you want your house to be dirty or do you want your house to be clean? And if you want our house to be clean, then we need to put things in it to keep it clean. Okay. So sometimes we are afraid to go to the doctors or we are afraid to hear the big diagnosis due to what the doctors have said in the past. And it can also cause emotional distress for us. But the truth has to be told. Okay. Some of the shame and the stigma around obesity are the fear of judgment. Society always and often stigmatizes obesity as a moral failure or lack of self control. And if you've never been there, you don't know it, because I used to be really skinny before I started having children, and then the weight started coming on. It was after my second child that I realized, no, I can't live like this anymore. And I was seeing the effect it was having on my life. So I had to make a decision to do something about it. So sometimes we just need that wake up call to know that, no, there is a solution for it. I've seen a lot of people pass away as of obesity related complications, which is very, very sad. Recently, we've heard about one of my 600-pound ladies that passed away. We've heard by some of the pronounced and celebrities that have passed away as a result of obesity and also the complications that it brings. So they can say, oh, she died from kidney failure. But what happens? She had high blood pressure uncontrolled as a result of the obesity, and now the kidney failed. So they're not going to say she died from obesity, but they'll say she died from kidney failure or complications from hypertension. So one thing leads to the other. Okay. Some of the reason also why people don't seek help is because of the negative past experiences. I've had patients tell me they've been to their doctors and the doctors were very insensitive about the situation and just blame them for being overweight or being obese, which can also have a negative impact on you. But when it's all said and done, they are just being real with you. So don't take it personal. Just receive it and make a decision to change it. So, like for instance, I had a patient with a thyroid issue, and the doctor told them, just eat less, or lose the weight and you'll be fine. Okay, yes, a lot of times losing the weight will make you feel better, can reverse those issues, but I always recommend that get testings done because thyroid problem can also make you gain weight. Just as the obesity can also lead to other problems, some other issues can also lead to the obesity. Okay. Sometimes the culture believes that society makes it feel like, some cultures are just being overweight as a sign of wealth, beauty, or fertility. Back in the days, I know like in some African countries, when you're obese, that means life is good. That means you're living a good life. But nowadays, even those people are becoming smart and wise about their health and they're taking actions. I know one time I was talking to someone who was very big and I asked her what she's doing about it. And she told me, oh, her husband likes it that way. Her husband likes her to be obese. This lady was almost 300 pounds. So my next question to her was, are you living your life for your husband? Because yes, your husband wants you big, meanwhile your husband is small. And she started thinking about it. I said, it's about your health. It's not about your looks. It's not about what people think about you. It's all about your health and how to prevent long-term problems from the obesity. Okay. Sometimes it's the fear of failure. Many patients that I've seen tells me I have tried different kind of diets. I've tried every program, but it seems like nothing works. Everything I do fails, which leads to hopelessness. Like there's no hope. I'm just going to stay fat forever. That's not a good way of approaching the situation. That's not a good attitude towards it. Yes, you may have tried many times and you have failed because obesity is a disease just like diabetes and hypertension and high cholesterol and all the other health problems that you can think of. You take medication to reduce the symptoms. Most people have to be on medicine for high blood pressure all their life, diabetes medicine all their life. But when it comes to obesity, they feel like they are failure because they didn't do what they have to do. Please don't blame yourself. It is a disease and it takes more than just healthy eating to solve that problems. There's help for you if you want to get treated. There is medication, there's treatment, there are therapies, there's so many things that you can use to treat obesity. Also, lack of access or awareness. Some people don't realize that there is treatment for obesity, or maybe the cost of treatment is what turns people away because it's not cheap. But if you really, really want to do it, there are cheaper options to lose the weight. Okay. So the motivation is what's going to drive you to make the right decision. So, for instance, somebody living in a low income area may not have access to a gym, fresh products, or even insurance coverage. But if you talk to the right people, there is help out there for you. Okay. How does it affect our mental health? Obesity affects our mental health in so many ways, and mental health also affects obesity. They go hand in hand. So, somebody with a mental health problem, maybe depression, anxiety, or trauma, can make it difficult to seek help or stay motivated. Hence, they're using food to cope with the problem. Sometimes parents use food as a coping mechanism for their children if they've been through trauma. That is not love. That is punishment to your child. So don't end up treating the child with unhealthy food and say you're showing them love. It's good for a moment, but long term, it's not going to benefit them. Okay. Okay. Sometimes obesity becomes a protective shield rather than a problem to fix. We get heavy and we see the problem and we feel like, okay, I'm using this as a barrier to something that I'm going through, or I'm using it as a way of dealing with other problems. But I'm telling you, obesity can kill you. Okay. Sometimes the pride and denial that there is a problem. Oh, I'm not big. I like the way I am. Okay. Whether you like the way you are or you don't like the way you are, once the numbers are going up, it's causing health problems. So it's all about the health problems. Sometimes it's not just about the look and the feel. If we want to deal with obesity, where do we start? We can start by first accepting or understanding that we have a problem. And we know we have a problem even before the doctors weigh you at the doctor's office. When you stand on the scale at home, you can tell there's a problem. When your clothes start feeling too tight on you, or you have to go to the next size, you know you have a problem. When you started having problem going up the stairs, you know you have a problem. When you can't run around your children like you used to or your grandchildren, you know you have a problem. So that's the beginning. You have to realize or understand that you have a problem. And once you come to that realization, then you have to ask yourself, what can I do to fix this problem? I know people that try to do it on their own and they are successful. They change their lifestyle, they change the way they eat, they change the way they drink, they start exercising, they start incorporating other things that need to be done, like sleeping better, reducing stress, drinking more water, and they get good results. Some people, they've tried all that and they still have a problem. So then what do? Then you need to seek professional help because there's help out there for you. And this may not be for you, but if you're married and your spouse is overweight or obese, think about him or her long term and think about what could happen to them if they don't get treated. So this is a conversation that you can have with them. This is something that you can talk to them about in a very, very nice way, not in a judgmental way, not in a way that would make them feel worse than they already feeling. So let's say, for instance, you've gained 50 pounds, 60 pounds over the years. And a lot of women will say, oh, now I have children, so it's normal. Well, I felt the same way when I started having children. I thought the weight gain is okay just because I have children. But when I started having problems with it, I realized if I don't do anything about it, it's going to cause more problems. So back in 2006, I made a decision that I'm going to work on my weight. And that's when I started my weight loss journey. I'm still on it because I told you obesity is a chronic disease. There's no cure for it, but you can treat the symptoms. And your goal is to remain healthy as much as you can. Okay. So if your child is overweight or obese, how do you handle that? Sometimes we have to be very careful how we address the issue because if not, it can cause more problem to the child. It can affect them emotionally, it can affect them physically. So you need to understand that it's a very sensitive topic to discuss. So make sure you're doing it in a way that it's not going to make them feel bad or feel that they are the problem, why they're like that. Okay. If these children are overweight and they express the need to get help, don't ignore it. A lot of times they are seeking for help because of what they're going through in school. A lot of children that are overweight or obese get bullied at school. They are isolated socially because society have make it look like you have to be skinny to belong. So when your children start acting differently, if they don't want to go to school or they come home very depressed, please start that conversation with them because it could be an issue with their weight and seek help for them. Go to the pediatrician, talk to them about it, and then find out ways that you can help the child. by even starting at home, changing the way you prepare your meals, going for walks with them, and having a conversation with them. Ignoring the topic is not going to fix the problem, because childhood obesity leads to adult obesity. So if you don't fix the problem as early as possible, they will grow up and they still have the issue, or they still stay obese, which can affect them in so many other different ways. Okay. And if they get help, also remember it's not a one time fix, and there's no quick fix when it comes to obesity. It's a process, it's a lifetime journey. So you have to be patient, and you have to understand that it takes one day at a time. So even if the first few weeks you don't lose anything, but you're not gaining, to me, that's a good result. That's a positive outcome, because it takes time. And once you stay consistent with what you're doing, you will see result. Consistency is key. Okay. When you don't treat obesity, it leads to other problems. For instance, if you start having shortness of breath or having difficulty breathing, even if you sleep and you snore a lot, or you stop breathing in your sleep, you probably need to be tested for sleep apnea. Called obstructive sleep apnea is one of the issues or some of the complications of obesity. Asthma and reduced lung function, increased risk of respiratory infection. I remember during pandemic, a lot of people that were overweight and obese and ended up having COVID, their complications was really severe, or they ended up dying compared to somebody who is normal weight. So obesity can reduce your ability to fight infection and just being able to get through the process easily. Sometimes we may have to put you on CPAP so you can sleep better, but don't use that as a solution. Use that as a beginning of your journey to lose the weight. A lot of people have lost weight and they were able to get off the CPAP. Okay, joint and bone problems. Weight can affect your joints, and you can see as you get older and the weights keep coming on. Now there are a lot of things that you cannot do. It makes you feel more pain, joints pain, like osteoarthritis in your knees, in your hip, in your spine. It reduces your mobility and chronic pain, back pain, and also increase your risk for disability. There are a lot of people that are disabled because of the obesity. And if you want to live a full life, a happy life, please let's take care of ourselves and make sure we seek help for our obesity problem. All right, cancer. There's a lot of cancers I mentioned it earlier that is related to obesity. So higher risk for cancers such as breast cancer, colon cancer, endometrial, kidney, they all have a higher risk because of the obesity. Chronic inflammation and hormonal imbalance also contribute to it. So, for instance, I'll have a patient say, I'm having a lot of body aches, I'm having a lot of pains. The doctors have done all kind of tests and they can't find anything. And my question to them is, how is your eating habits? So they start going on the sugar, carbohydrates. They can affect your body. So once they change those lifestyle, they feel better and those pains and aches improve. So don't just say, oh, I'm having knee pain and not do anything about the weight, because the weight could make it worse. Because every 5 pounds you gain, you're putting 20 pounds on your body. Every 5 pounds you lose, you're taking 20 pounds off your body. So make sure that you are doing what you need to do to take the weight off than to add to it. Okay. What are some of the emotional and mental health impacts? Obesity can also lead to depression, anxiety, and low self esteem, especially in the young population. A lot of teenagers have this issue, but they don't know how to address it. Social isolation and stigma. Of course, it leads to emotional eating. People tell emotional eating because they are stressed, because they are tired, because nothing seems to be working. But there is help out there. Fertility and hormonal issues, especially for women as we get older, we have a lot of changes in the hormones, which can lead to weight gain. And you can say, oh, it's from the menopause or pre-menopause. I understand that, but it doesn't mean we have to accept that. That means we have to do something about it so it doesn't continue to affect us. Irregular periods and PCOS in women. People will ask me, okay, is it the PCOS that causes the obesity or the obesity that causes the PCOS? I say it could be either one, but it's here. One have to fight the other. So we can put you on medication for the PCOS, but if you don't lose the weight, a lot of times it's hard to treat. And we can also treat the obesity and the PCOS will improve. So don't just say I have it and not do anything about it. Because once you have PCOS, it's difficult to lose weight. For men, obesity can reduce sperm count and also testosterone in men can be reduced, which for men is a big deal. So if you're a guy and you're obese or you're overweight, check yourself out. Okay. Pregnancy complications. Now, if you're young and you're still in the process of having children, gestational diabetes is very big, and also preeclampsia, and also miscarriages. A lot of people that are overweight or they're obese, they have a higher chance of having miscarriages or just having difficulty conceiving because of their bigger surface area. What else can obesity cause? Liver disease. Okay, so there's something called fatty liver, which I'm sure you may have heard about it, but most people contribute that to alcohol drinking. Yes, alcohol can cause those problems, but there's also one called non-alcoholic fatty liver disease, NAFLD, which also increase your risk for cirrhosis and also liver failure. A lot of times we don't even know we have it until the doctors actually test you for it. So, or do an ultrasound or CAT scan of the abdomen, then they can see that. But if it goes untreated, that can cause more health issues. So if your doctor diagnosed you with fatty liver, don't just sit there and not do anything about it. Just try your best. Start working on the weight loss and see if that's not going to improve. A lot of my patients that comes to me, they've had fatty liver and I've worked with them and they've seen good results. Okay. It's all about your health. Okay. Even financially, obesity can affect you financially and socially. So, beyond your health, the cost of managing obesity is huge. Think about days where you can go to work because you woke up sick, back pain, shortness of breath, a lot of little things as a result of the obesity. That's losing money. Even discrimination and reduced quality of life. When you're obese and you apply for certain jobs, they may not tell you that they didn't hire you because of obesity, but you are going to be a liability to them. And that's probably the reason why they didn't hire you. But if they tell you that, that's discrimination. So they're not supposed to tell you that it's because of the weight. But you can tell that they didn't hire you because you have the qualification, you have everything that you need. But Miss, I'm sorry, we can offer you the job. Sometimes it's because you're becoming or you're going to be a liability to them. Obesity becomes a vicious cycle, especially if it runs in the family. My parents are obese, my grandparents are obese, so automatically I'm going to be obese. Back in the days, they didn't have a lot of treatment options like they do now. So if something that has been in the family for generations, tell yourself, I'm not going to be part of that statistics. So you start a new cycle of fixing the problem so the people that are coming after you or the generations after you, they'll also benefit from knowing that there is a solution, there's help for it. Because if you're obese and your child is obese, you cannot tell your child to lose weight or your spouse to lose weight if you're in the same boat. Okay. Obesity can cause a lot of pain, and inactivity will lead to more weight gain. If you're depressed, emotional eating, it will lead to more weight gain. You have chronic diseases, you're taking medications. A lot of medications that we take have side effects of weight gain, which can cause more complications and more weight gain. Okay, so without an intervention, obesity worsens over time. Breaking the cycle requires very, very, very intentional mindset or holistic strategy. It cannot be just one thing. Just eating healthy cannot fix the problem. It may stop the process from getting worse, or it may give you a short term solution, but long term, a lot of times the weight comes back. Okay. So prevention and early intervention is key. We have to stop the domino effect. We have to really sit down and think about how is my eating habits? How are my portion size? What am I putting in my body? And what is that food doing to me? Am I exercising? Am I staying active? Am I just sitting here and not doing anything and being lazy? Or am I taking advantage of the equipment that I have at home or the gym that I can go to work out? And you have to be very intentional about it. You have to add it to your schedule. It has to be a routine and there has to be a consistency. Regular health checkups is very important. Or even you can join a support group. There are a lot of support groups out there that helps people that are overweight or obese to get better. It's never too late to start. Sometimes you feel like even though I've done everything and I'm still obese, there's so many other things that you can do. Even if you're able to lose 5% to 10% of your weight, you can reduce your risk very, very, very much. So every little bit counts. Obesity is a life threatening condition, but we don't talk about it. And untreated obesity affects every system in your body. Long term effects can be fatal, but can be preventable. Stroke has gone on a rise, one because of uncontrolled hypertension and just stress and the way our lifestyle has become. So empower yourself and others to make healthier choices because it's not just you. You having obesity affects you, but also affect the people around you. Okay. So it's not just about the looks. It's a matter of life and death, and you understanding why you need to lose the weight can be the beginning of the journey. I work in a healthcare system where my goal is to prevent health problems, to prevent chronic diseases, and to help people that have been diagnosed with chronic problems reduce the long term complications of those problems, mainly by reducing their weight and changing their lifestyle. Because obesity is a complex disease, it's not just a matter of willpower. It's influenced by so many things. I've already mentioned genetics, your environment, your emotions, your lifestyle, your culture, some medications that you're on. All those things can affect your inability to lose the weight. And blaming people doesn't help. We like to blame other people. I know people that will get married and start blaming the wife for their weight gain because now they're cooking food that they never eat in the past. So now good life has made them gain weight. Or again, the women are stressing them out, or the men are stressing them out, or the children are stressing them out. So we like to blame other people for our problem. Just understand that it's your problem. Whether you blame somebody or not, it is your problems. The numbers are rising, and so are the risk. When you watch TV, a lot of the commercials you see is about food and it's about medicine. Why? You eat, you gain weight, you get sick, we treat you. So it has become a cycle that has created a system that's keeping us going. But I can tell you, you don't want to be part of that statistic. So do something about it. Try to seek help if you can. If you cannot, I'm here. You can always reach out to me, Dr. Eugenia Caternor. You can call me at 443-356-0007, and I could help you come up with a plan and how we can help this solution. So I'm not going to keep on talking because I know we may have a lot of questions, but I also have one of my patients on the line, actually, maybe two, that would like to share a little bit about their experience in um, the weight loss journey and why they decide to start the weight loss journey and how it has helped them. So if Miss Jamie is on the line, you can unmute yourself and share something about your journey for to us.
My name is Jamie Peace. I guess I can. All right. So I started my weight loss journey in May 31st, 2023. At that time, I was about, I think, 258 pounds, around there. And I met with Dr. Eugenia, and they helped me with with the B12 lipo and also Manjaro. So I am a diabetic, a type 2 diabetic. So the great thing about it is that my insurance paid for it, which was awesome because it gets pretty expensive. But it basically completely changed my life. Other than that, I made some lifestyle changes, which I needed to do. At first, I was in the gym every day. And I became kind of obsessed with it because as the weight started to melt off, and I loved the results, I was like, oh my God, this is awesome. So from May 31st to, I would say, end of November, I lost about 60 pounds. My goal was to get under 200 pounds, and I just kept on saying to Dr. Eugenia, look, I got to get under two. I don't care if it's 199. It could be 199.8, but it just has to be under 200 pounds. And I got there, and felt so much difference as far as everything that I did. Walking up the stairs, as Dr. Eugenia talked about, walking up the stairs, just I'm in property management, going to my sites and walking around the properties and just being able to do it with ease. Portion control. My stomach shrunk, and so I couldn't eat as much as I usually ate, but I still ate the things that I liked. I just made sure that I made better changes. So brown rice versus white rice. I still eat my fufu, but smaller portions. And it's been life changing for me. And so here I am. This will be, that was 2 years ago, actually. And I am about 194 pounds. I'm giving my weight away, but either way, 194 pounds, fitting comfortably in a medium. And I've maintained my weight, still active. My A1C went from being like 13 to 6.2. It might be even lower than that now, but just all around, everything has changed. Blood pressure, everything has changed. My numbers, my labs are great. So I'm grateful. And so yeah, that's pretty much it.
Thank you. Thank you so much, Miss Jamie. And it's such a good feeling. It's such a good feeling. And you go out and you feel more confident. I mean, you send me pictures of you on vacations.
Tons. I sent her tons of pictures. Yeah, I've always sending pictures. So it's exciting. Um, Going shopping is different. I used to not want to go out. It affected my mental health. I did not want to go out. People invite me places, and I'm like, I don't look the way that I want to look. And so now I'm like, where are we going? All right, let's go. So I do feel so much more confident, and that's been amazing. So, but the health factor is really the most important. But yes, just looking good also definitely makes a huge difference.
Very good. Very. So, what do you think will be one of the advices that you share with the people that are trying to lose weight, or they see it as, it's never going to work?
Um, so one, I'm living proof that it does work. So it does work. It really takes consistency, patience. Because there were times I would go and the other Dr. Eugenia will tell you, I'd be like, oh my God, I gained 2 pounds or I didn't move. And I was like, okay, next week. And she'd explain to me, look, you're in the gym every day. You're building all this muscle. So remember, muscle weighs more than fat. It's going to fluctuate. Just don't worry about it. And I just kept on going. And no matter whether it was up or down or, whatever, I just kept on going. Some weeks it was great. I got on the scale and it was like 4 pounds gone. And it was like, yes. So consistency, I would say that you have to do everything. You can't just rely on, oh, I'm just going to take this shot and it's just going to drop off. You have to do everything, change your eating habits. You have to work out. Even if it's a 20-minute walk, you have to keep your body moving, keep your heart pumping. You have to do those things. You have to do light weights to kind of build the muscle too, as you lose weight. So um, I would say definitely be consistent. I would also say mentally prepare yourself, and also pray. I prayed quite a bit. Like, God, please help me. I have to lose this weight. So, yeah, all of those things work.
Good, good. So, what do you think the support system had to do with it?
Um, for me, the support system was just cheering me on, makes a huge difference. People noticing too. People like actually saying, "Oh my God, what did you do?" People were coming to you left and right, and they still do. They still say, look at me and say, "What in the world did you do?" And I say, I went to transformation, Dr. Eugenia. Here goes the number. Reach out to her, because when they see that it works, they want to do it too. So I think my support system was awesome in just cheering me on and helping me, just telling me sometimes like, hey, you're doing good, whatever, and that made a big difference.
Good, good. Because you're not in this by yourself, you're not alone. And sometimes people try to do it by themselves, and I get it. But coming to a place like Transformations, I mean, just the support we give you, and just
Yes.
sometimes you come to share your, uh, discouragement with us. Okay, as you said, I didn't lose anything, or I went on vacation, I came back, I gained 5 pounds. But we cheer you on. We make sure that you're not giving up, but you're actually keeping on the fight, because it's a lifetime journey.
Yes, it is for sure. The other thing is like sometimes I would come in and the days that I come, the same people will come on those days. And so we, sometimes I think Dr. Eugenia wanted to put us out because we're in, like we're in the lobby and we're kind of like cheering each other on. They're cheering me on, I'm cheering them on and saying, how much did you lose? Great, you're doing good. Are you walking? Are you, like that was also awesome too, just seeing the same people and seeing what they were doing and seeing how their life was changing. That definitely helps you to keep going too.
Yeah, very good. Very. Thank you so much. And
You are welcome.
I know sometimes people worry about the maintenance. That hey, once I lose the weight, then what's next? How are you maintaining?
I honestly have maintained by just habit. I developed better habits. And I'm going to be honest and say a lot of it is portion control. I used to eat, I mean, culturally, like, I ate a lot of rice. My rice and soup, my rice is like this. And just the portion control made a big difference. And then just staying active. I still weigh myself every day, when I wake up, just because it's just a habit now. You know what I mean? Some people don't have to do that. But for me, that's really important. Also, I would say I definitely watch my sugar intake. So I used to drink like 4 liters of ginger ale a day, and it was easy. And so I didn't realize how much sugar I was putting into my body, how much sodium I was putting into my body. So I would say just cutting out those bad habits and developing new, healthier habits have helped me to maintain.
Very good, very good. Thank you so much for joining us today and sharing your experience. Because for some of us, this is what we need, or
Yeah.
we need to hear that. Listen, there's help out there, and once you put your mind to it, and you have the right people in your circle, you can do it.
Yes,
Because
you can.
it's more than just a one person disease. It's it's a whole system. It's a whole system, and you need other people to tag along with you as you go through the journey. So
Yeah.
thank you so much. And I mean, we love you, and you're definitely a walking advertisement for Transformation Center for Weight Loss. You have
Thank
brought
you.
so many clients to us, and trust me, they are still coming. They still mention your name and say, I don't know what for her, I want the same thing, you know.
That's
And
awesome.
sometimes I say that not to say, hey, you can't do it on your own. But sometimes seeing somebody go through it and
Yeah.
encourages you and motivates you to know that, hey, you can also do it. I remember one lady came and she said she met you in a parking lot and she didn't recognize
Yes.
you.
Yes, that's true. She walked by me. That is very true. And I was like, "Hi, you used to work for me." And she was like, and she said, "What? I want to do whatever you're doing." No, no, no. Give it to me right now. I said, "I have the flyer in my car. You want to come to my car?" And I gave it to her. That is very true. And I gave it to her, and she was very happy. And I think she came like within days. She was
I
in
think
your office. So
yeah.
yeah.
So
So
that people want help, people want to do it, but sometimes they don't know that there's help out there or they don't know where to start. So if you're doing it, I mean, as I told you, obesity is a disease that's obvious. Everybody can see it.
yeah,
Even if you have HIV, high blood pressure, nobody sees that. But
yeah,
obesity is obvious. So when you're losing the weight, people know that you're doing something,
yeah.
you know. So don't just lie and say, oh no, I'm not doing anything, I just changed my lifestyle. Yes, you change your lifestyle, but did something else help you in changing the lifestyle?
Yes,
You know,
absolutely.
yes. So thank you so much. And as your prayers, this is a problem of the mind, the problem of the body, of the soul, of the spirit. It takes everything together. So you need to pray, ask God for strength, ask God for help, ask God, listen, I'm struggling, I need help, and just commit it into his hand. So it could be an issue of addiction to food, it could be inactivity, or just not motivated to get up and go work out. When you pray, God will come through for you. So thank you so much for adding that point, because I'm a big believer that, hey, when we go to God in any circumstances, any situation, he's there, he hears our prayers. So this is also something we can take into prayers,
Absolutely.
everything
Absolutely.
else. Not just
Yeah.
pray, sit for miracle. Because actually, I was talking to this pastor and his wife, I think right after the pandemic, and he had COVID, and he almost died because he's really obese and he went to kidney failure. He was
Oh, wow.
intubated. It was really bad. So I went to visit them at home. So, I mean, both him and the wife are obese. So I asked the wife, so what are we going to do about this weight? Oh, we've been praying about it. We're just waiting on God to help us and show us what to do. So then my next question is, so why didn't you pray about the high blood pressure that you're taking medicine for? Why didn't you pray about the diabetes that you're taking medicine for? Why didn't you put about the sleep apnea that you putting on CPAP every night to sleep? But you're praying to God about obesity. Meanwhile, it's obesity that led to all the other problems. Oh, I guess you're right. So sometimes people just don't know or realize that there is help for the obesity.
Yeah, absolutely.
Yeah, but
Absolutely.
once you treat obesity, a lot of the other problems can reduce, because some of them, like type 2 diabetes, hypertension, most of them are reversible, or at least we can reduce the risk to a very minimal level that we don't have to take 3, 4, 5 pills for it, maybe one pill, or maybe not at all. So please, obesity is a killer. It's a big problem in our society, but it's also preventable and it's manageable. Okay. So don't feel like you're in this alone. Don't feel like there's no hope. There is solutions out there for you. Okay. Thank you so much for joining us, Miss Jamie. We are so
Absolutely
glad to.
not a problem. Thank you.
You're welcome. I don't know if Miss Kathy is on the line, but Miss Kathy said she was going to also join us and share her story.
Hi.
Hi, Miss Kathy.
Hi. Um, I don't know, I started and I went off and I started again. And I don't know how long it's been, but I'm down a lot of pounds and you always help me when I'm up and you're like, what did you do? Or you're on your period and then I get down like, oh yeah, I am on my period and then she just it's a lifestyle change and you gotta just change everything you eat. And I go to the gym 4 to 5 times a week. And hopefully I get down to the 160 mark. I'm getting close.
Yes, yes. So how does it feel to have all this excess?
Feels good. Like she was saying, like you go up the steps and huffing and a puffing and it's hard to breathe. And then I just went on my daughter's 5th grade field trip and we walked around Annapolis. And it's so much easier to walk around. And buying clothes is so much nicer. You can look cute and feel nice in them instead of because I hated buying clothes because nothing fit and it always looked not nice in them, you know.
Good, good. So what helped you the most during the journey or through the process?
I'm sorry you broke up. What did you say?
So what do you think helped the most
Uh,
fighting journey or going through this journey?
I mean, this shots definitely helped because I'm not as hungry and then doesn't crave a lot of sweets anymore. And then I don't know. I always read before if you ate bad stuff, you get sick for some reason. I don't know if that's true or not. So I kind of stay away from the bad stuff because I'm scared. I don't want to get sick.
Okay, right. So yeah, so it's a lifetime journey, and
Yeah.
to get to your goal, we just need to continue the healthy lifestyle. And I mean, you feel better that you don't want to go back to the way you used to be.
Right. Yeah, I
We're
gave all my clothes away. I don't want to do that.
not
It's a lot of
taking,
money.
yes, we're not buying any big sizes. We'll do whatever we need to do to fit in those clothes. And for some of the patient, they always ask about maintenance. There is
Yes.
we are here for you. We are always going to be here with you. And once you get to your goal, we put you in the maintenance program and check on you, keep you in the loop so you don't feel like, okay, it's done with it. So now I can go back to the old lifestyle. Because once you go back to the old lifestyle, you're going to start gaining the weight.
Right. Yep.
So you need to stay with us, even if it's once every 3 months, just check in. Hey, I'm doing well. Oh, whoops, I've gained 5 pounds. What do I need to do? Let me help you get that 5 pounds off. No.
Yeah. And I always send you pictures in my weight every week too. Tomorrow you
Yeah.
get mine in the morning.
So it's that accountability.
Yes.
That
Yep.
accountability is key.
Yes.
Yeah.
Every week. Yep.
You got to stay accountable and you have to stay consistent.
Yes.
Okay. Well, thank you so much, Miss Kathy, for joining us.
Sure. Thanks for having me.
You're welcome.
And thanks for your help.
Thank you. You're welcome. Yes. All right. Anybody have any questions or anything to add before we end? I can take 1 or 2 questions. All right. So it looks like we don't have any questions. Everybody's good. So as you've heard from 2 of my clients, there is help out there, and just asking for help is the beginning of the journey. And there's a lot of medications that FDA approved to help you go through the journey, so you don't feel like you're using willpower, or yeah, you're using willpower, or you're doing this by yourself. You need the support system. You need people around you to help you um, fight this battle. I have my information out there. If anybody needs to contact me, anybody needs to get more information about how we serve our community, how we can help you lose the weight. It could be for yourself, it could be for your loved one, it could be for your neighbors, your co-workers. Please share our information. But our goal is to save more lives. Our goal is to reduce a lot of the chronic diseases from getting worse, or from creating more health issues for us by helping people lose weight. So if you need help, we are here to help you. 443-356-0007. It's three zeros, by the way, before the seven. So it's 443-356-0007. Or you can visit us online, www.tcwlmd.com. And if you reach out to me and told me, or you tell me you heard about us on the podcast, you get 10% off your first visit. Thank you all for joining, and I hope to see you all in about 2 weeks. But please share this information with everybody out there that's trying to lose weight, stay healthy, or even if they're already in a healthy weight and they just want to learn how to stay healthy or maintain the weight. So you can also reach out to us. Thank you all for joining us. Have a blessed week, and we'll see you in about 2 weeks. Bye bye.